I'm a public contributor for RSS University of Southampton Partners. And I am going to talk about why patient and public involvement is important in grant applications and generally in research. Um, so, some decades ago, it was kind of thought that health services and health research was about doing things to or for people, um, rather than by or with them. And over the decades, as patient and public involvement has evolved, it's very much about thinking about, why research matters to people, what particular aspects of research matter, and also what aspects of patient delivery matter. It's about making shared decisions. It's about working collaboratively. And so it's become very, very important in terms of research delivery and health services. So, who or what is a patient? Well, we come in all different shapes and sizes, and we have different skill sets, and we can't all do the same thing that you ask us to, but we can do some things that you don't ask us to and might be useful to you. So when we're presented in front of you, don't think of us as this kind of generic blob of people that have the same thoughts and feelings and skills. Think of us as all being different. So, who are the patients and public? Well, you will be at some point a patient or a member of the public. We all are. So, that involves everybody. Um, and in this context, in health and social care research, it could be carers, it could be patients, it could be charity workers, it could be people had very long-term conditions, or cared for people who are a long time, who know an awful lot about the conditions or about care paths for people, and may actually bring things that you've never thought about, may also know the history of delivery of care. And the other thing to remember is that patients have got a life outside of research. They're not just, as I said, these generic beings. They've had a career, possibly. They've brought children up. They've had a family life. They have hobbies and skills, and it's always worth thinking about what those are. And don't assume that they don't understand your field of research. They may not understand everything about it, but there will be something that they do. So the thing is that it's important to listen to public contributors and participants and consider if they need any training. If they've got certain skills, what could be done to support them, to be able to help you with your work. So this is me. I'm one member of the public. Um, I was a curator for 25 years, and I worked a lot with artists and scientists. And we did a lot of research projects. So I already understood research in a completely different field, and I also understood about interdisciplinary working. Um, I I decided that I wanted to kind of go and train for in health. I'd always wanted to get involved at some point. I hadn't quite figured out how. So I trained to be an independent advocate has been incredibly useful, and got an MSc in psychology. And I started to get more and more involved in PPIE, and I'll talk about that a little bit more later. One of the things I'm particularly proud of, as you can see, there's lots of different conditions that our family, either as a carer or as somebody who has it myself, that we have. And my mother, in particular, had a dual diagnosis at the end of her life of dementia and schizophrenia. And I wrote a blog. There's a link there. And I've also started to become a lived experience researcher, and I'm hoping to go on and do a PhD around that dual diagnosis. Um, so. I've sort of given a bit of background on who the public are and what we are and what skills we might have. What is PPIE in research? It's really wide and varied. And there was a systematic review from 2019 by Tricia Greenhalgh that revealed that there were 65 different frameworks for PPIE. And I imagine in those 7 years, there have been a lot more invented and drawn up. So it's a very broad church. It's not really clear. There are so many different ways of doing it, but there are some sort of guides and frameworks in place, standard ones that I'll tell you about later that you can use as a guide. Um, PPIE is Patient and Public Involvement and Engagement. That's the full title. Um, it means actively involving patients and public in the activities of your research. So design, research design, research delivery, dissemination, helping them to write getting them to help you write papers, and so on and so on. I'll go a little bit more into that. And then the engagement part of it is raising awareness of what you're doing. So that sort of thing would be, going into a shopping centre, maybe with a stand and talking about your research with the public. So that's one example of many examples of engagement. So there is a difference between these different terms, even though they're in PPIE. We've got involvement, participation, engagement, and inclusion, which I've talked about. And the NIHR have started to put this activity under people and communities. So just doing a very brief kind of overview of what these different what these different titles mean. Involvement is the point at which you get members of the public actively involved in your research. So that's getting them to help you design their research, help you design research questions, help you to deliver the research and disseminate it. Participation, that's when people are your data points. They might be giving blood, they might be interviewed, they might be trying out a new intervention, and they're your participants. And then the engagement, as I said, is about you raising awareness and disseminating what you've done. And then I'd like to bring in some newer terms that are beginning to kind of get some traction and are evolving within the NIHR and beyond. And one is community engagement, and that's identifying community or communities or an area, a location possibly, that you want to focus on. And you maybe want to spend a bit longer getting to know those people and getting them involved in research activities and getting them to be actively involved, possibly even working co-productively, which I'll come on to in a minute, with you to to deliver research and design research. And then finally, another very important one, particularly if you're going to be applying for a grant, is research inclusion. And that's ensuring that the research that you're doing reflects the population, that the general population, and it's as diverse as it possibly can be, that it reflects protected characteristics under the Equality Act and addresses health inequalities. And it's really important that you're aware of all these four things. And PPIE and research inclusion, or EDI, equality, diversity and inclusion, are mandatory now for applying for NIHR funding. It's really important that you're aware of that and that you get that into your funding applications. So a little bit about my experience, just giving you a snapshot of one person and what happened to me. I hadn't even thought about health research until 2012, when my mother was given the diagnosis of dementia and then was invited to join a trial on looking at the long-term use of antipsychotics. Now, my mum was not really a trusting person. She hated the medical profession, and so she refused. But I kind of went away thinking, oh, that's really interesting. I wonder what happens with that. And I spoke to the psychologist and got to know a bit more about it. And then coincidentally, the following year, I was diagnosed with macular degeneration, and I was invited to be part of a focus group looking at, it was actually looking at early onset, not dementia, sorry, macular degeneration. And for me, although I was involved in that, I never heard anything back, and that will be a theme in my talk. It really opened my eyes, and also over the 12 years that I've had treatment, or actually it's longer now, 13 years, I have seen treatments really improve, and I'm pretty sure that has been, in fact, I've been told it's to do with the feedback that patients have given in part. There are other things as well that patients have given during their treatment. And then I became From that, I got more and more interested and found out more and more about PPIE and got involved in all sorts of different aspects of PPIE across the NIHR and other organizations. Um, I've represented themes, specific themes like mental health and social care. I've co-authored such strategy documents, co-authored papers, and as I've said, I'm doing my own work as well. And I also sat on funding committees. Um, so that last slide dealt with some of the things that I've done in terms of involvement. My experience as a pit participant, I have to say, has been fairly mixed, mixed to bad, really. So the first one I got involved with was as a carer and talking about carers' experience of people with dementia, and that was a survey. It was a very poorly devised survey. If they'd involved patients a bit more, they would have known that the polar answers are not what carers give. So, you know, you usually are, it's usually somewhere in the middle. And the interview questions, because it was a mixed methods research, wasn't so great either. And of course, I never heard back what the results of that was. The second one was much more interesting. It was an in-depth interview about the psychological impact of caring. And I got really excited by that. And they promised me they'd send me their paper. Never received it. I never even found out what was happening. And the third one was a bigger study on diabetes and mental illness. And unfortunately, I was picked to go into the control arm. Um, and actually, I haven't. They're still probably working on the results of that. It's a very big study, and I think I probably will get some feedback from that. And I've had some thank you cards as well. So these little things actually mean a lot if you're a patient. And finally, I was on a study around liver function in people with diabetes. One visit involved a simple blood testing questionnaire, and the second one was about getting a fibro scan. Luckily for me, in some ways, I didn't meet the inclusion criteria because my liver wasn't scarred enough. But again, lots of promises of feedback and papers, never heard a thing. So there's a whole range of things to learn from that patients actually in the first instance could have really helped with the design of the research. And please always feedback, always let us know how you've got on because we give of our time and we'd like to hear from you about what's been happening. So how can you bring people into research? The answer is across the research cycle, there isn't a bit where patients and carers cannot be involved, and you need to be creative and inventive. These slides are going to go in your pack, so I'm going to leave you to look at this, but just have a think about, we've divided this up into design and improval, delivery and making a difference. And I'll talk about those across the cycle, where we've positioned it on the map is where it is. This particular cycle was designed by Louise Ting, who's a fellow public contributor. And it's been widely used. You might see it quite often in relation to PPIE and the research cycle. So it's really worth having a look at that and having a think about it. And then here's a very busy slide about all the different ways or an example of all the different ways. You be as creative as you like and think about how you can bring people in within, safety limitations and so on. You have to take these things into consideration, but be as inventive as you can in terms of involvement of the public. So I'm just going to pick a few out. So a really common one is that public contributors get involved in plain English summaries, participation information sheets. They get involved in setting the research priorities and questions. So that's one side. In terms of the delivery, you might have people on a steering group involved in feeding back. They might review results and identify themes from interviews. They might actually set up the interviews. They might even be involved in the interviewing process if it's appropriate. And my particular favourite is co-production, where you have members of the public as co-applicants. They're usually PPIE applicants, but it could be elsewhere. And when if you're really, and this doesn't happen very often, if you're really taking a punt, you could let a patient lead on the research or co-lead at least. Um, and then you basically, in terms of dissemination, as I've probably talked about before, in terms of writing joint papers, um, advising on whether an intervention actually is going to work, even if the study has proven that it would work, um, and giving papers at conferences. So that's just a few things. Um, so we've talked a little bit about involvement. There's a range of different frameworks, but this one's based on Ornstein's ladder of involvement. And this gives you a kind of guide on the different ways in which people can get involved. So there's informing, so that's telling people on a website, for example, about the research, consulting, asking people what they think about participant information sheets or plain English summaries, involving them, getting them to write the plain English summary, getting them to help you define the research questions, collaboration, actually bringing them in as co-applicants perhaps, or as as PPIE leads. And then empowerment is the bit I was talking about around true co-production, where you're working equally as partners across a research project. So hopefully it's coming clear why PPIE is important in research. But it really does have an impact. It can make a difference to the way you do research, because there are things about patient experience that you may not have thought about. And I've got many examples of research being changed down to patient experience, or perhaps some kind of intervention not working. Perhaps if it's a kind of tangible 3D intervention, it might just not be very comfortable, and so on. But also patients can be involved in helping you define your research topics. It can keep things realistic, so that so that you might have ideas, but you don't, actually, in terms of whether it matters to the public, it's not clear. And then also the really important thing about PPIE is that it holds research to account. It checks that it's value for money, and that it's relevant to people, and that it's not some, very niche piece of work that may not actually have a lot of public benefit. And then benefits to researchers and public. So for the public, I have found PPIE amazingly empowering, especially for someone who thought, oh, maybe I'll have a go at finding, getting involved in health. I'm not sure where it'll take me. But PPIE has been wonderful. I've sat on executive committees, I'm on national committees, but also I'm working on lots of research projects that really do help you understand the system, the health and social care system, make you feel useful, and also, bring new skills and knowledge. And for researchers, you become more aware of lived experience and how that's important in research. As I've said, it can change your research, it can change team working, it can build communication skills, and above all, patient and public involvement tends to increase impact. So I'd said that there were a few standards, and these are the national ones, the UK standards for public involvement, and they are being revised, not revised in terms of their content, but I think the way they're being disseminated online a bit is being revised at the moment. But they're still there, and you can go and find out, and it gives you lots of ideas about how to make sure that you cover these, the baseline of involvement in research. And then finally, it's worth knowing about the NIHR strategic commitments for 2025 to 2030. So I've talked about research inclusion and how important that is in your applications, strengthening partnerships, that community engagement, working with people, developing partnerships with people, improved reward and recognition. Make sure that you pay your public contributors at the rate that the NIHR guidelines set out. It's really important that you strive to do that. And then the one I've kept going on about, require feedback. Make sure you keep in touch with people, tell them what you've been doing. And finally, if you've got an enthusiastic and willing participant or public contributor, give them the training that they need to get more involved. If you think, oh well, I can't involve them, for example, I got sent on a good clinical practice course because it helped me to be involved in a particular intervention, on a study that I was involved in. Um, and finally, thank you very much for listening. I hope I've given some flavour of why it's important to me as a patient. There's the reference for Tricia Greenhalgh, the frameworks, and also I was involved in a study around. I woke researchers up to the fact that independent advocates are actually incredibly useful for developing research, particularly in social care. And we did a collaborative article on that work.
I'm going to talk for the next sort of 20 minutes or so about some of the more practical elements of thinking about and setting up patient and public involvement work in the development of grant applications. I've worked for the Research Support Service for a number of years, and one of the kind of the main things that I find researchers, and particularly researchers who perhaps haven't done PPI before, struggle with is just thinking about how to kind of how to start getting the ball in motion, as it were, in terms of establishing and planning for and setting up the work that needs to be done around patient and public involvement. So we're going to talk a little bit about the sort of logistics of that. I know Helen has already spoken about this actually, so I won't spend too much time on this, but just to say that for the purposes of this presentation, I may use a number of different terms, depending on the funding stream that you're going for. Patient and public involvement or public involvement may be described as different things. Within NIHR applications, it's talked about as people and communities currently. I am kind of I'm talking about the broad principles of involving service users and members of the public in partnership, essentially. And these are just some of the examples here. So patient and public involvement, people and communities. I'm having a moment there. What's that one? Public. Oh, I don't even know. Public involvement and community engagement is the last one. And patient and public involvement and engagement is the one before. There you go. There's too many. Even I can't keep up with them all. So yeah, I'm talking about the broad principles, and whatever funding stream you're applying for, these ideas and these approaches should be applicable. What I will do is focus in a little bit on the NIHR standard application form. So again, I recognise that probably not everybody on the call is going to be applying for an NIHR funding stream, but I would imagine that the majority of people are, and NIHR is often kind of seen as a gold standard in terms of the approach and the requirements that they have for patient and public involvement. So I think it's a good example to use regardless of your funding stream that you're going for. It's probably also worth mentioning that some of the NIHR application forms don't follow this exact format, and for example, the fellowships might look a little bit different. But again, the kind of broad principles will apply. So with an NIHR standard application form, there will be two stages, generally speaking, an outline stage and a full stage. In terms of people and communities or patient and public involvement, there are two areas within the outline stage that you will be expected to consider your PPI work and to be able to reflect on some of the work that you've done. So within the detailed research plan, which is 5 pages long, so it is really tight and it is a really challenging kind of word count to get all of the information that you need to get included. There is an expectation within that you include information about working in partnership with those affected by your research. So it's a kind of broad a kind of broad collection of people, including kind of stakeholders, potentially staff, but certainly patients and the public as well. And there does need to be kind of threaded and embedded throughout that detailed research plan. And I'll give a few examples in a couple of slides, but there does need to be some examples of the ways in which patient and public involvement representatives will help you deliver on or have helped you shape that work. You'll also need to submit a plain English summary within your outline stage of an application form. And so, as Helen said, this is an area which you may seek input from your PPI representatives on. It's also an opportunity for you to say a little bit about the PPI work that you've done. So you might include a kind of short paragraph or a few sentences about some of the kind of key areas of impact, for example, that your PPI representatives have had. For a full stage application, you will have the detailed research plan, and at this point there will be 15 pages, or depending on the funding stream that might vary a little bit, but it will be significantly more than at the outline stage. And again, there will be an expectation that you include information in this around how you have been or how you will be working in partnership with people that are affected by your research. And that includes patient and public involvement representatives. So really this is the same as at the outline stage, but there's just a lot more scope for you to go into additional detail and provide more information about your partnerships with broader stakeholders and with public partners and things like that. Your plain English summary doesn't change from outline to full. You are able to change it if you want to amend and update it, but in terms of the requirements for NIHR, the word count and things like that is the same. In addition, for the full stage application, you will need to submit a section called People and Communities, and this is 3,500 characters. And this is to really give you the opportunity to describe in detail the work that you have done and that you will do in terms of working with members of the public and working with community groups and partners to help shape and to help deliver on your research plan. So just to give you a little bit more detail about what the NIHR expect from that People and Communities section, what they say is that you will need to summarise how you ensure the different stages of your research cycle are directly shaped and influenced by the lived experience of diverse people and communities. And this is where you will include any information on patient and public involvement as well. So you want to include in this section a summary of all your PPI work that you've done to date. So that could include things like describing people's backgrounds and experiences, how they've worked with you, the contributions that they've made, and really, really importantly, the impact that it has had on your application. This is absolutely key from a kind of funding panel perspective. What they really want to be able to understand in terms of kind of meaningful involvement is how members of the public's input and feedback has actually been taken on board by the research team, and how changes and amendments have been made to the methodology, for example, in order to address potential concerns or issues that are raised by public involvement representatives. You will also need to include an overview of your plans, so your plans going forward for your research project. So you'll need to talk about who's going to continue to be involved and in what sort of format. So whether you're going to have an advisory group or whether you might have individual people who support on a trial management committee or something like that. Whether you're going to do community engagement work in order to reach a broader range of people. It's also useful if you can to kind of reflect a little bit on the sort of demography or the experiences of those that are being that are involved, so that the panel can understand the kind of diversity of perspectives that you're able to capture. So the role is really important. So exactly what it is, and again, this kind of links to the sort of idea of impact. So it's all very well and good having people who are involved, but they really need to have a clear role, and that role needs to be meaningful. They need to be doing things that will actually impact and affect and change and contribute to the research. And you'll also need to include things like training and payment and information about support and mentorship and things like that as well. I haven't got it on here, but you may also include something around evaluation, evaluating your people and community work, your PPI work. And there are other things, of course, that you can include, and it will depend on a kind of topic by topic basis, but here's a kind of good overview. In terms of that detailed research plan, which you are asked to describe how you will work with people and communities in more detail. This, as I mentioned previously, is a kind of more of an umbrella description of working with stakeholders more generally. So it can include kind of healthcare workers or service planners, decision makers. It also should include information about your patient and public involvement work. It's always worth checking with individual funders whether there's any specific requirements. Obviously, I'm just giving an example of the NIHR standard application form here, but there will be nuances within different funding streams and within different NIHR funding streams. So really, this is an opportunity for you to really embed and detail some of the activities that you're planning through your proposal. So trying to kind of demonstrate how working with people and communities is really part of and is integral to the work that you'll be delivering. This helps to create a really clear justification and a narrative which supports the strength of your application. Just a few examples here. And again, it really will depend on the project that you're doing and what's appropriate and what's proportionate, but just as a very rough idea, in your background and rationale, you might want to include something around whether the work is a priority for the service users or the end users. In the aims and objectives, you might want to identify whether patient and public involvement helped and contributed to defining the outcome measures. And in the methods, you may want to describe how your plans are acceptable to participants through collaboration and discussion with PPI. Okay, so I'm just going to move on now to talking a little bit about some of the kind of the practical steps that you might want to go through in order to actually set up an initial PPI meeting. So the first thing that you would want to do is to think really carefully about who it is that needs to be included in your public involvement work. So you need to think about who your population are that you need to hear from, that can kind of bring that insight and that perspective of being on the ground, or of kind of helping you think about what it would be like to be asked to take part in this study, and are the methods that you're proposing acceptable, and are there going to be barriers that prevent people from taking part in the study. So you need to kind of really think about who your research participants might be, or who the end users of your intervention or your research might be. It may be that you have a study where it's you need to hear from the general population, and you actually need to just try and capture a sort of broad, diverse range of views. It really will depend on your project. So I kind of referred to it in one of my previous slides, but some groups are generally not considered PPI by NIHR. So, for example, healthcare workers. So you would need to kind of take that into consideration when you're thinking about who should be included in your work. It's really important to consider broad perspectives and how you make sure you're kind of capturing different viewpoints. So I've got here, would a retired professional have the same barriers to participation as a working parent? Or, you know, any other kind of difference between people? What are you doing to ensure that you're considering the different range of perspectives and potential? And, you know, your PPI can really help unpick some of the really known challenges of kind of recruitment and retention in research studies. And in order to do that, it's important that you think about who are your kind of underserved populations that need to be part of those conversations. It's also really important to consider whether there's sort of particular issues like cultural sensitivities that need to be considered before your patient and public involvement work. And if that is the case, or if there's another kind of nuance that you need to take into account, then how do you do that in a sensitive and appropriate way? And so I've just given an example here of, could you work with a community representative to support you to be inclusive in your approach? But, you know, again, each project is different, and you'll need to think about what would be an appropriate model to use, or an appropriate route to go down in terms of ensuring that you're doing the work in the best way possible. So in terms of recruiting and setting up for an initial meeting, there are kind of multiple different options that you can go down in terms of thinking of identifying people. Some of the more common ones that we see are things like reaching out to existing groups. So if your research is on in a particular community or on a particular disease area, then it may be a good approach to kind of link in with existing community groups or patient support groups, and try and kind of form relationships and partnerships there, and through that link in with a kind of broader patient or community public group. We do actually have, so I say here RSS database, the RSS Southampton, we do have a database of PPI contributors, so we can circulate things like adverts around to those in case there's people that are interested. I haven't actually got it on this slide, but there is a website called People in Research, which is hosted by NIHR, and you can, as a researcher, you can put information about your research project on that, and public contributors can kind of go on and have a look and contact you if they're interested. It would be acceptable to kind of reach out to individuals. So, for example, in a kind of clinical setting or something like that, you wouldn't kind of need ethics or anything like that with patient and public involvement, because you are seeking to have kind of consultations and working with people in a kind of partnership relationship rather than as a researcher and a participant. It doesn't need ethics approval. So assuming it's kind of considered appropriate within your individual context, it would be okay to approach people in a clinical setting. You could advertise through forums online. This comes with a bit of a caveat, and that is that to be careful of kind of things like auto-generated AI responses and what have you. But as a kind of principle, it would be okay to do that. For all of these things, you would want to provide a really clear overview of the project. You'd want to provide details of the role and the payment. So generally speaking, when people recruit for an initial PPI meeting, it is just for that first meeting. So it's a kind of one-off. Can we get together and have a conversation about my research project and talk about some of your ideas and views on what I'm proposing? You could either decide in advance on the meeting location and format, or you could wait until you hear from members of the public and ask them what they prefer. But again, this can take lots of different forms. So it could be in the community, it could be face-to-face, it could be virtual, any of those are fine. And also one-to-one discussions or group discussions are both acceptable. Sometimes group discussions are a bit richer and a bit more interesting, but equally you may find that practically it doesn't work for people to kind of identify a time that everyone's available, or it may be that you have a research topic area which is kind of particularly sensitive or personal and people wouldn't feel comfortable in a group, so you kind of need to make decisions based on kind of what is appropriate in your context. In terms of running a session for a PPI group, it's useful to have a rough agenda with areas that will benefit from input. It's also useful to allow for flexibility. People will sometimes come up with things that you haven't considered, or identify areas that need consideration that you hadn't kind of that you haven't considered, and that's really important that you've got the kind of time and the flexibility to give time to those sorts of discussions. It's also really important to use plain English and to be clear about roles and expectations. So, so everybody understands why they're there, what they're doing, and that you're able to kind of, from a kind of communications point of view, be on the same level as your public involvement representatives and work with them as partners. And that does involve you being able to kind of really strip back sometimes some of the more technical elements of the work that you're doing. It is really important. Facilitation skills are really important. So, do just have a think about who in your team would be the best person for that. Again, kind of depending on the topic or depending on the context of the group or the people that you're talking to, it may be that it's not the PI who's the best placed person to conduct these sessions, and that's fine. Generally speaking, we don't record patient and public involvement meetings. It would be, you can technically, if you wanted to, you'd need to ask permission, obviously, but it's not necessary, and you don't really need things verbatim. It's much more about understanding the kind of broad issues and principles and feedback that people are providing. So you would need to kind of have a think about whether somebody, if anybody, would be taking notes. And these kind of initial meetings or one-to-ones or whatever it might be can often be used as a sort of starting point for future collaboration. So you can use them to talk about your ongoing plans for involvement if your research is funded, and whether people would be interested in kind of continuing to work with you. I've kind of made reference to this a couple of times previously, but just to kind of really reiterate that it is really important to think about inclusive PPI, and with the acknowledgement that it's never going to be truly representative, but it does need to be as diverse as possible. I've got a reference here, but involving people from a diverse kind of with a range of diverse kind of characteristics at the design phase can and will really improve how the research is conducted, but it will also make it much more relevant to the broader population as well. One of the sort of concerns, I guess, is that if we continue to design research that is not appropriate for underserved communities, so is perhaps designed in a way that's accessible and easy for people from certain backgrounds to participate in, but not from others, then we end up with results that perhaps don't reflect the needs of those communities that haven't been able to participate, and we run the risk of widening health inequalities. So it's really, really important that we think about these issues from the very beginning, and making sure that in order to design the most inclusive research that we possibly can, we need to ensure that we've got inclusive patient and public involvement approaches, informing how that looks. I have got 2 case studies, but I think I'm just going to have time for one, which is fine because I know that everybody received the slides before the session. So the second case study will be on there. It's just 2 kind of examples of different approaches, just so you can kind of see what practically see what approaches were taken in the development of an NIHR grant application. So the first case study that I'm going to do is around a project that was called Gateway, and this was a randomized control trial, economic and qualitative evaluation to examine the effectiveness of an out-of-court community-based gateway intervention program aimed at improving health and well-being for young adult offenders, victim satisfaction, and reducing recidivism. It did have a shorter title. I don't know why I haven't included that one as well. So I supported on the development of this grant application, and then when it was funded, I was costed in to be the PPI lead for this. So I delivered on the PPI work within this project as well. Just to give you a kind of a brief overview of what the project was about, I'm going to just run through a PICO. So it was That the population was young adults, so people who were 18 to 24, who had been arrested for and accepted responsibility for a crime, and the location was in Southampton. There was a definition of the types of crime that they could have been arrested for, which would have made them eligible. So it was kind of non-violent crime, non-sexual offences, what I guess may be kind of broadly considered as kind of petty criminal activity. The intervention was called Gateway. So the Gateway was the name of the intervention, and it was a 16-week program of support, which was delivered through one-to-one sessions with kind of trained, they were called navigators, but trained staff members, support staff, and with group work with other young adults who were on the Gateway program. The control was usual care, so it was a randomized control trial. Young adults were randomized into either receiving Gateway or to receiving usual care. And the outcome was a range of self-reported health and well-being measures, which included drug and alcohol use and things like mental health. And there was also a 5-year follow-up on recidivism, so reoffending rates, and that used routine data. So in the development of the grant application, the things that, as the research team, that we really wanted to understand was some of the potential barriers to recruitment. We knew that recruitment would be challenging in this population, and we wanted to think about and mitigate some of that risk as much as we possibly could. We wanted to be sure we were capturing the right outcomes, and that the questions that we were seeking to answer would be kind of useful for these young people. We wanted to understand what some of the main concerns would be about taking part for some of these young adults. It's kind of links into the recruitment. And we wanted to know what the best way to share information about the study to potential participants. There was a range of other things as well, but this kind of is an example of some of the areas that we discussed. So one of the things that we did straight away was link in with a charity organisation. So obviously, thinking about that first question, who are my PPI representatives and who am I going to get kind of useful feedback and information from? We knew that we needed to speak to young adults who had been kind of within the justice system in some way or another. It wouldn't have been useful for us to go to a sort of existing PPI group with kind of middle class retired people in it, for example. We really needed to get the perspectives of people that could understand the sort of unique needs and challenges of this quite kind of vulnerable population. So we linked in with one of our partner charity organisations, which is the Hampton Trust, and they provide lots of support for victims of crime, for families of people who've been accused of crime, and for people who have been accused of crime. And so they work really intensively in that space. And they were already running some programs with young people who were the sort of same age and had the same life experiences of those people that we were looking to recruit within the study. So we also recognised that particular population, probably we would struggle to do things like set up a group meeting. Quite often there's sort of challenges, kind of people might be living chaotic lives or have lots of kind of competing priorities and things like that. So we decided that the best approach would be to go along to an existing session. So we attended a session that the Hampton Trust were delivering with these young people. And then at the end, we kind of stood up and had a little bit of we gave them a bit of information about the project, and we invited them to stay and talk to us. But there was no expectation that they did. And that way we were there in their space, somewhere that they already were, and they just had the option to stay and have a chat with us. And that worked really well. So some of the key feedbacks from that discussion was that was around some of the outcome measures. So things that were seen as most valuable to people. So included things like mental health and well-being, and also things that felt very tangible, like employment or homelessness. There was a lot of distrust of the police. So this was a really, really significant barrier to recruitment. And we knew that we needed to kind of address or kind of think about how we were going to mitigate that. There were lots of challenges raised around things like the location of data collection meetings. So once the study was up and running, there were queries around where we would be meeting with participants to collect data. One of the things that we hadn't really thought about was around what is kind of essentially sort of like gang territories, and young people who would not want to move from one kind of neighbourhood within Southampton to another neighbourhood if there was some sort of dispute or something like that going on across neighbourhoods. So we needed to be really mindful about kind of ensuring participants' kind of willingness to come to us and their safety and things like that. Privacy and data was a massive concern, and leaflets were not considered accessible to people. So just to kind of example of the impact, outcomes were refined to ensure they were capturing the issues that were important to people. There were mitigating steps that needed to be introduced to really be clear about who was the research teams of the university and who was the police. And this became quite a big bit of ongoing work that needed kind of various different approaches throughout the course of the study. We linked with a wide range of community organisations, so there was a lot of locations available. We were really clear about confidentiality and data sharing, and we also developed a video alongside the patient information sheet as a kind of accessible way of accessing that information. In terms of our ongoing plans for involvement, we had a PPI collaborator. So it was an individual who identified himself as an ex-offender. So he now worked as a kind of peer mentor for young people, but he joined our management committee and continued to kind of give advice throughout, and he co-designed our recruitment video. We also continued to work with Hampton Trust and did ad hoc involvement with young adults through the sessions that they were running in the same way that we had done before. We also had a victim PPI collaborator from a charity, and we did outreach work within the community to understand better the kind of wider community's views and perspectives on the study.
This presentation is on community engagement and inclusive PPI. So if you're unsure of what community engagement is, think of it as laying the foundation to inclusive PPI, helping you to reach a much wider demographic and open doors for future involvement. Community engagement starts with understanding the community. You want to get to know and build relationship with them. And the more time you spend in the community setting, the more you'll become a familiar face, which all helps to build trust. Involving the community organisation can provide you with valuable insight and help you to identify people for your PPI activity. If you haven't done community engagement before, it can seem a bit daunting to know where to start. But firstly, have a think about who you want to speak with and hear from. A little bit like Megan said previously, identifying the right people and community is key, and consider which voices need to be included in the conversation. Think about people with lived experience who may be more adversely affected because of things like income, education, ethnicity, disability, gender, age, or even where they live. Next, have a think about the community organisation most relevant to connect with, who will help you to identify the people you most want to hear from. And partnering with trusted organisations helps open doors and creates a space where people feel really comfortable to share their thoughts. Then think about planning and preparing the PPI activity. Planning ensures that the conversations you're having with people, although informal, still have a purpose, direction, and an intended outcome. Ideally, involve the community organisation staff in this, because they are the experts on their community and their insights can help shape a process that works for everyone involved. Inviting them to join a session can help the people feel there's a familiar, trusted presence, and that will help them to feel more relaxed to share with you. So you might be wondering at what point community engagement becomes PPI. Well, once community members are joining you in the activity and sharing their views and feedback, it moves from community engagement to PPI and starts informing the research design. For example, they can tell you if they feel the research idea is relevant and important, whether it's the right question to be asking. They can tell you if they feel it's acceptable and meaningful to public and patients. They could also tell you if it makes sense, if it's accessible and inclusive, and if there's anything that's missing that should be included. It's actually difficult for PPI not to be inclusive following effective community engagement because they complement each other, strengthening both the impact and the reach. But it's worth remembering that PPI doesn't answer the research question, it informs your research. So thinking about inclusive PPI, it looks like working with trusted community organisations who already engage with underrepresented or marginalised people. It also looks like a welcoming environment where people feel safe to share their experiences, removing practical barriers and holding sessions in community venues that are familiar to the people and also easily accessible, and considering timing and flexibility such as evenings or weekends for those who are working. Using plain language and avoiding jargon so everybody can understand and contribute. And providing some sort of food and drink alongside conversations, because that really does sort of give that sense of conversations around the kitchen table, as it were. Providing translation, interpretation, or literacy support where needed, and using creative ways to prompt conversations. And finally, giving feedback and sharing how their input has made a difference, and that's really important. Community conversations is a novel approach which supports researchers to connect with and involve people from underserved communities before submitting a grant application. It delivers meaningful and inclusive PPI right from the outset, bringing a broad range of diverse voices into the research process. People with lived experience take part in 2 interactive and informal sessions, and this approach ensures that research proposals are informed by real experiences and community insights. Sessions are carefully and collaboratively co-designed to create an environment where people with lived experience can contribute through guided conversations alongside food and providing meaningful input that shapes the research application. We support the researchers to clarify objectives for the PPI activity, to plan the content, to identify a small number of people to engage with, and to lead the sessions. I'd like to share a quick case study of a researcher who used the community conversations approach. So Emma wanted to connect with and hear from parents. We collaborated with the staff at the Family Hub, and they helped Emma to decide on the right image and wording so the advert was appealing, attractive, and at the same time was clear on who it was actually for. And in this case, it was for mothers who had experienced mental health problems during pregnancy or in the first year of their baby's life and had previously received support from children's services. Staff suggested visual and content-based prompts. These prompts included audio recordings of quotes, use of pictures, and a really creative way of prioritising what was important to them before, during, and after involvement with children's services. They recommended resources to facilitate the conversations, and they suggested a safe process for sharing and signposting to sources of support given the nature of the project and discussions. So as you can see, there's huge value in collaborating with the staff. Parents helped Emma to understand that services need to be sensitive to the traumas they've experienced, to understand that having service intervention again feels very hard. They shared that long waits for services was difficult and having a quick check-in call would show care. They valued honest communication and felt that this builds trust. And they also shared that when services end, it can feel actually quite overwhelming, as well as feeling like a vote of confidence. So another check-in call then would be really helpful. About sort of 6 months after the community conversations, Emma was invited to provide feedback on her project to everyone involved, including staff. So saying thank you and providing feedback is so important because it builds trust. People can see that their contributions are taken seriously, not ignored. It shows respect and value because it recognises their lived experience. It encourages continued involvement because people are more likely to get involved again if they see they've helped make a positive difference. It strengthens relationships. Openness and transparency deepens the connections with communities. It improves the quality of PPI, so feedback helps people understand how to shape future input, and supports accountability, so it demonstrates that engagement is meaningful, not tokenistic. So I want to share this lovely piece of feedback from one of the parents after the session. It's made me think a lot about some things that was discussed. And when I was speaking to a family member, I was able to tell them there's people out there that's doing good and are doing what they can to change ways for people. And giving her a bit of hope changed her mood to a positive attitude as she's struggling with the battle of social services. I just thought, it's so easy to underestimate the power of listening and involving people. These conversations don't just inform research, they can give people a sense that change is actually possible and also reassurance that what they think really matters. So it's worth remembering that community engagement and inclusive PPI strengthens funding applications. It ensures that research is relevant and impactful. PPI isn't a tick box exercise, it's built on relationships and trust. So taking the time to listen, adapt, and genuinely involve communities by investing in community engagement. Community conversations is just one approach with principles that apply across any community engagement model. So it's a way of sort of bringing a broad range of diverse voices into the research process. And then investing in these efforts ensures that research is done with communities rather than to communities. So here are a few key points to consider when planning inclusive PPI, kind of building on what Megan's previously talked about. So think about the space that you're inviting people into. Could you use a room with the community organisation or within the community somewhere that's easily accessible? What's the aim and objective of the PPI activity? What do you want to understand by the end of the activity or session? And work backwards from there to help you plan. Use simple prompts to support conversations and make it accessible and interactive. So be really creative. Use things like photos and images, pictures, words, statements, possibly audio, to encourage discussion and find out what's really important to people. PPI, again, I've said before, is not research. It doesn't answer the research question. It informs and shapes the research design and proposal. Therefore, conversations are not recorded. And I know that Megan said technically, but you could. But I think really thinking about the context of being within a community setting, it could be something that puts people off taking part in those conversations. So we encourage researchers to just jot some notes down, the pertinent points that can help when they're refining their proposal. Make the session welcoming, so provide the food and drinks. It really helps, and it helps also to break the ice. If the session lasts longer than an hour, think about building a 5-minute comfort break. And where possible, hold sessions without children present, because that actually supports concentration and meaningful involvement. Obviously, if that's not feasible, careful and collaborative planning with the community organisations recommended, so that to ensure that everyone can take part in conversations effectively. And finally, it's that thank you and follow up again, closing the loop. It's so important. The people you're listening to and involving just need to know that their contributions mattered, how it made a difference. So providing an update and showing how their input influenced your funding application goes a long way to ensuring that they feel valued and heard. So finally, some useful resources on the who, what and how of engaging with and involving underserved communities and research. The NIHR has produced this include roadmap of the who you need to be involving and what you need to be thinking of. And Birmingham University have published this very helpful step-by-step guide to an inclusive research cycle, which is the how to get going.
I'm going to talk about funding for patient and public involvement. Okay, lots of people ask us about costing for PPI in funding applications, and this is something that is really important to consider because funding bodies review this and they check that your costings match up with the activities that you've described in your application. There are no set guidelines on the amount of money that you're expected to spend on PPI, and how much you spend really depends on your project and the activities and the level of involvement you're planning with the people and the communities you'll be working with. So costings for PPI can vary quite widely between projects, and your plans should be appropriate for your research area, and your costs should be proportionate to the planned activities which showed meaningful involvement with the public. It's important to take a pragmatic approach and allocate resources that support meaningful involvement that adds value to your research. You need to ensure good value for money, but also think about what you can realistically deliver within the scope and the timeline of your project. These are some of the costs you'll need to consider. In terms of time, there aren't specific guidelines for reimbursement of time, but there are recommendations. NIHR recommend paying £27.50 per hour, but you can pay your PPI members more if you want to. This is just a guideline from them. You can provide options for how people are paid, offering vouchers instead for their time. And if you're holding online discussions, NIHR recommend paying PPI members £5 per meeting to cover remote or home working costs, which can include the use of a phone or internet connection to join meetings or printing. When asking people to attend meetings in person, then travel expenses and parking need to be considered, as well as venue hire or contributions to a community space and refreshments. Projects that involve talking to parents of young children or other carers may need expenses for childcare or for caring. And if you're working with people whose first language isn't English, then it might be necessary to translate some of the materials. So you may require translation services and interpreters, depending on the activities you're carrying out. If you're thinking of ongoing PPI plans and having PPI members working with you throughout the delivery of your project, then attending relevant courses and formal training for both PPI members and for yourself could be really useful. Here are a few examples of flexible and inclusive approaches to payment and recognition that you may want to consider when planning PPI activities. The options available will depend on the financial processes within your host institution. So these are intended as examples rather than definite approaches. And it's important to check with your institution whether they can offer these options. If you're offering vouchers, you can ask PPI members which shop vouchers they prefer, bearing in mind the vouchers that your institution is able to buy. This gives PPI members flexibility in deciding where to spend their vouchers, and it makes the recognition more relevant and centered towards them. Usually vouchers are purchased through a finance department and then emailed directly to PPI members after a PPI activity. but vouchers can also be distributed in other ways. You can ask your finance department if they can purchase vouchers in advance, and you can distribute them yourself or through an organisation you're working with to PPI members who take part. This works well for informal or opportunistic PPI activities. So, for example, conversations at community events, and it means PPI members can be reimbursed immediately after involvement. It also means that individuals don't need to share personal details such as their email address, which some people may be reluctant to share, and some people may not even have an email address. It might also be appropriate to recognise the contribution of community organisations themselves. For example, if an organisation has waived venue hire costs or supported your involvement activities in other ways, you could offer them a donation or vouchers, or you could ask them if they have a wish list and purchase an item from their list as a way of saying thank you. So overall, these approaches make payment and recognition more flexible. So if you can choose which works best for the communities you're working with. We encourage people to think creatively and flexibly about how they reimburse and thank people for their time and support. One researcher we supported was working with people from lower socio-economic backgrounds who were not regularly engaging with health services. And rather than expecting people to travel to him, he partnered with a local food bank and put up posters and shared information leaflets to invite people who were using the food bank to talk with him about his project in a familiar community setting. He contacted his finance department to ask whether grocery vouchers could be purchased in advance, which they agreed to, and they gave the vouchers to him. And he then had conversations with people when they came to the food bank, and vouchers were given to them immediately afterwards, which made the whole process more personal, as PPI members received immediate recognition for their contribution. And the researcher also made a physical contribution to the food bank in recognition of their organisation's support and for providing a space for these conversations. This approach helped make the involvement more accessible, and it reduced some of the barriers that can come with traditional reimbursement. It also demonstrated that reimbursement and recognition can be adapted to better suit different community settings and people's circumstances. When it comes to costing for PPI, it's helpful to work backwards from your plan. Because there's no set amount to apply for, it's best to first think about what your plan is, who you're going to be working with, where these activities will take place, and what role your PPI members will have. And once you know that, you can start to work out how much each of these activities is going to cost and what this is going to look for in terms of the budget. The funding you apply for won't cover any pre-grant PPI activities, so you'll have to think about identifying potential sources of funding for this. Pre-grant PPI activities are performed before the submission of your grant application, and you'll be including details of these activities in your application. When looking for sources of funding for pre-grant PPI, it's worth checking whether your academic department has any funds available to support these activities. And you can also apply for funding from an RSS hub. All 8 of our hubs have some funding available for pre-grant PPI work that can be applied for. This funding is called the PEER, which stands for the Public Involvement and Engagement Resource. And you can ask the hub that you're working with for more details about this. Over the next couple of slides, I'm going to go into more detail about the PEER. As I mentioned earlier, all of our hubs provide this, and while the process and funding amounts may vary slightly between hubs, they are broadly similar. The information on these slides show what we offer at the Southampton and Partners RSS. You can apply for up to £400 to support the involvement of the public in developing your grant application for your research project. And your PPI activities may include things such as a discussion group or meetings or events with patients or other members of the public. These are usually standalone public involvement activities like discussions or meetings, which will inform the development of your grant application. I'm going to give you a quick overview of the peer process. I know this slide is quite detailed and you may not be able to see all the text, so I'll just talk you through the key steps. The peer is offered as a package of support, and it starts simply by requesting support from our hub, and you can arrange a one-to-one conversation with a PPI advisor to talk through your application and your ideas for involvement. And after that discussion, you'll be sent the peer application form along with the guidance notes. The form asks some background on your project and your proposed PPI plans, so it builds directly on what you've already discussed with an advisor. A key focus of the peer is making involvement inclusive and meaningful, so you'll need to clearly describe who you want to involve and how. You'll also be asked to outline the costs for your PPI activities. Once you submit your application, it's reviewed by the PPI team and you'll usually get a decision within 2 weeks. And one important point to highlight is that this funding is specifically for PPI activities and for reimbursing public members. It's not really intended for broader stakeholder events involving professionals or academics, so that the focus stays on meaningful public involvement.